Good morning to everyone. My name is David Saucedo. I live and I was born in Monterrey, Mexico. That's the northeast of Mexico. I'm a medical doctor and an old age psychiatrist. My work deals mainly with people with several types of dementia. I'm a faculty as well for some other med schools. And mainly my work deals with getting people acquainted with these as diseases and not seeing them as what would be normal. There's lots of social stigma around mental health all around the entire world, especially in our country. We have to deal with this fact, and people will at the most see dementia only as a cognitive impairment and not what goes with it as well, for example, as the behavioral and psychological symptoms in dementia. So in my private practice, I deal with family crisis when they're all full of burden, being as caregivers, and lots of questions upon the disease and what could they expect from treatment. As a faculty as well, there's lots of things that have to be addressed with medical doctors in the sense of what is going on the development for neurosciences diseases, especially for dementia. And so there's lots of work to do, not only with families, patients, but as well as on the medical sector.
You've faced a lot of families in your career. Just a quick question. What do you say to them? How do you break the news?
Well, I think that has to mainly on the stage that we're dealing with. First of all, there's lots of concerns on what could they expect from treatment. And afterwards, when we get to see the neuropsychiatric part, which really has lots of burden, they'll just go very confused about how can they deal with the fact that, for example, her wife or his mother is just doing some senseless things around house and asking every time to be taken to her house when they're in their own house. So as a family therapist as well, I always try to take a first look about how is that the family dynamics working in that patient, and who is the one that usually has to do the work, not even being told that he or she was going to be doing the caregiving job. So sometimes one has to explore how was the past story between family, between the daughter, the son, and that would in some terms explain the quality of the caregiving now as a new problem in the family.